Hello, good day, and welcome to the Health Show on Nta News24, where we bring you the latest global trends, insights, and updates on the health sector. My name is Salome Eferimo, and we are dedicated to educating and informing you about pressing health matters affecting our society today. In today's episode, we'll be looking at HIV, also meet our personality, health personality of the week, and also we'll talk about our regular program, our regular segment on phytomedicine with Dr. Hamadu. In the HIV segment, we'll be talking with Dr. Fatima Anga, a senior registrar in the Department of Obstetrics and Gynecology in the Federal Medical Center in Abuja. Dr. Anga is a highly respected specialist in her field, and today she'll be sharing her experiences with us on the critical topic of HIV, prevention and management of the disease. As you know, HIV remains a significant health issue, not only in Nigeria, but across the globe. Despite advancements in medicine, prevention and effective management remain essential in reducing the impact of this disease. Dr. Anga will help us understand the latest strategies in HIV prevention and to manage the condition effectively. And what more can be done to combat this virus. We are thrilled to have her here, and I'm sure you will find today's discussion very interesting. Dr. Anga, you're welcome to the program.
Thank you very much.
Now,
I'm glad to be here.
Thank you. Without wasting much time, let us take a break, take a breather, and then we'll come back to the topic. Okay. Don't go away.
Health is wealth. Folded letters and insightful information in Medicare and health technology. Join us live on Nta News24 every Saturday at 4 p.m. as we delve into the current advancement in healthcare delivery in today's world. For sponsorship, participation, and inquiries, you can reach us on the following numbers: 0703 424 3412 or 0805 999 4444. Tune to Nta News24 on YouTube, DSTV channel 419, GoTV channel 26, Star Times channel 101 and 433, and Free TV channel 703. Keep a date with us, 4 p.m. Saturdays, with repeat broadcast on 8:05 p.m. Mondays. Don't miss it.
Okay, welcome back. So, Dr. Anga,
yes,
here we are. Yeah. HIV has been around for years now, and a lot of families have lost very, very loved ones to this disease. In your experience as an obstetrician and a gynecologist, especially at the Federal Medical Center in Abuja, can you tell us what your experiences have been?
Okay, well, globally, I would say HIV, as you have said earlier, has been a great problem for the healthcare system in general. And then, of course, Nigeria is not out of it. And then it has been on record that the highest burden of the disease is actually in sub-Saharan Africa. So, of course, since Nigeria is in sub-Saharan Africa, then we expect that we have the burden of the disease quite high around this region of the world. So, coming down to Federal Medical Center, Abuja, yes, I'd say the statistics is quite significant to some extent, because we actually see, particularly in my field where I am, where we have to take care of pregnant women and then, of course, the unborn child in the womb. So we see a number of them. But I think because we are actually in an urban setting, that's Federal Capital Territory, where people are aware, so we tend to see a number of people that come with the disease, but they are already on medication, and then they have list of the symptoms that, you know, arise as a result of complication of the disease.
Okay, so as a layman, I'm living my life, and then suddenly I'm feeling unwell. Yeah. What signs should I be looking out for to even have an inkling that it is related to HIV?
Okay, basically HIV symptoms, especially in the early stage, it tends to be asymptomatic. That's to say, sometimes you may not even have the symptoms, especially when it's early. However, once it sets in, like probably after the first 3 months or thereabouts, you tend to see that the patient may have some general symptoms that you may even think is malaria, like feeling unwell, having fever, cough, even catarrh sometimes, body aches. It can actually mimic that. And then if that persists for a long time, because what HIV does is that once the virus gets into the system, it attacks the immune system. And then when it attacks the immune system, it tends to bring down the immune system and then predispose the individual to infections. And so that's the reason why at some stage or at some point in time, when the HIV continues to live within the system of the individual, bringing down the immune system, you tend to see some opportunistic infections. So in that regard, I can actually say we actually stage the disease into like 3 different stages. Okay, in the first stage, that is when you come down, you see the individuals coming down with, malaria, that's general, feeling unwell, having, fever, headache, generalized body weakness, all that. And then as it progresses, you tend to see that the symptoms deepen and then they worsen, and that is when you see individuals, when it gets to the final stage, you see individuals with HIV having tuberculosis or even having other opportunistic infections like oral thrush, like having candidiasis. All those are, like AIDS-defining illnesses.
At what point does the rashes come up? Because I've heard people talk about rashes as part of the symptoms that come up that are associated with it.
Yes, actually. So rashes would actually be classified either under stage 2 or stage 3 of the disease. That's when the disease has actually progressed to a large extent.
Okay, so now as a pregnant woman, I find out that I have HIV and the unborn child is there. I don't know, how does it affect the child in the womb and during birth?
Okay, there's a concept we actually call prevention of mother-to-child transmission. Okay, so transmission of HIV from the mother to the unborn child has been found to be through, different routes. Okay, it could be through the placental routes, because, the placenta, the link between the mother and the child when the child is in utero is actually the placenta. And then that placenta actually, through the umbilical cord transmits food and then, in form of nutrients, let's say, not basically the solid food you see, in form of nutrients and then gaseous substances. And so because of that transmission, bacteria and viruses can also be transmitted to the child. Yes, in that regard. So that is one major way a child in utero can actually have the virus transmitted from the mother to the child. However, when the mother gives birth to the child, the transmission can actually be vertical or horizontal per se. That's basically through breastfeeding or even during delivery. As the child is coming out of the birth canal and then child gets exposed to certain, secretions around the mother's birth canal, eventually the child can actually contract the disease.
That's really serious then.
Yeah.
Okay, so but I've seen persons that have given birth to babies and they are not breastfeeding them. They will not tell you why, but from what you're saying, it seems that could be a reason why some kids are not breastfed from the first day of birth.
Yes, actually, okay, so in this particular context of prevention of mother-to-child transmission, once we get the women during the antenatal period, these women classified as those who have HIV, what we tend to do is to, counsel them appropriately and then link them to the appropriate support that they need. Now, through that support, they actually get medications that are right and appropriate for them during pregnancy. Now, those medications actually try to reduce the viral load of the disease. If it reduces the viral load, it means that it has suppressed the disease in such a way that the virus can rarely be transmitted to the child.
Wow.
So that is the major reason why we always advocate that women that are outside, having this disease should always come for antenatal. Even if you don't know you have the disease, some of them, we just find it during antenatal. Because when you come, it is compulsory that we screen you for main viruses that we know can actually harm the fetus.
So the screening of HIV is routinized in pregnant women?
Exactly.
Great. That is
Every
nice.
pregnant woman that comes for antenatal must undergo screening for HIV.
Okay, now how do you contract the disease in the first place? Ordinary persons, we'll be talking about pregnant women and but ordinary young people
contracting the disease.
How do you get it?
Okay, contraction of HIV, basically the main route of transmission is through sexual intercourse. Okay, so recently, of course, I know there are different definition of sexual intercourse. Of course, there is intercourse basically from straight people, that's through the vagina and then through the anals and what have you, but whatever form of intercourse transmits HIV. That's one way. Secondly, also mixture of body fluids, like how I've explained, between the mother and the child. Okay, that's another means. And then also intravenous drug users, like those that inject themselves with drugs. You just pick up syringes, put the drug, and then you feel you can inject. You do that regularly and probably even share with other people. So you don't know who it is that has the virus, and you don't know where it is that you are picking the syringe from.
Okay,
so
so
you
that
tend to
syringe,
inject yourself.
That syringe now has to do with contact with blood.
Yes,
so
exactly.
sharing, like getting your blood into somebody else's
Exactly.
system.
So that's one way. And then also sharing of sharps. It could even be within the house. You don't know who has the virus.
Like razors,
then,
razor
yes,
blades and
exactly.
stuff.
Although the transmission rate is very low with those sharps that hardly retain blood, but then there is also risk of transmission.
Well, I know that in Nigeria, our women have tried a lot in our salons, for example, where you go to do your nails and they use sharp stuff. You have to use one at a time, and you throw it away. Now, how do you prevent it? If I'm a married woman, for example, I went to a hospital and I got it through my dentist, for example.
Okay.
Yeah, maybe I used some equipment that is unfortunately not properly sterilized. And I contacted. How do we manage it in the family? Husband, wife, partners, how do you manage it? One person has, the other one doesn't have.
Okay. So that's what we call serodiscordant couple. Okay, so this particular person has, and then this other person doesn't have the virus. Now, when they come to the hospital, specifically, of course, some of them try to, come to seek for help. And then so what we do is that we counsel on different means of how you are going to survive. The number one and most effective way of reducing the transmission is by taking medication. So the partner that has the virus has to be regular on his or her medication. Because if you continue to take the medication, it reduces the strength of the virus, and then of course it reduces the risk of transmission.
Can they still make babies?
They can.
So how do they do that?
Okay, so we also counsel them on how they can actually make babies. There's something we call like timed intercourse. The timed intercourse has to do with, the woman, probably either way, whether the woman or the man is the one that has, we tell you, specifically during your ovulation period is when you have intercourse with your husband. If you actually want to have babies, you understand? So you time the intercourse, that is one way. However, if you're not able to time the intercourse, then of course we could actually advise on different ways. Like we do what we call intrauterine insemination. We pick the semen from the husband, we wash it and then inject into the female. That's just like a mere explanation of what we do. You could do that. Then, of course, for general intercourse that you just do with your wife without thinking of, having babies, you could just use condoms just to prevent that. Okay, so
it's possible to have babies without condoms if you just have it during your ovulation, or are there drugs that the men or the women take so that
it can prevent? Yes, there's also something we call pre-exposure or post-exposure prophylaxis, and there are actually medications also that can be channeled to prevent the the contraction of the virus. So the individual can actually take those medications prior to the intercourse or just after the intercourse. Okay,
right now I know that the federal government is on a campaign of getting everybody vaccinated against HPV, that is the human papilloma virus. And in a bid to eradicate cervical cancer. I want to just explain to us persons living with HIV, their predisposition to that disease, and how they could manage it more effectively based on their exposure to the disease.
Okay, you know, initially when I was discussing, I said HIV, what it does is that it brings down the immune system. So now by bringing down the immune system, of course, it predisposes the individual to getting infection. So one of the infection that has been associated with HIV is this cervical cancer. Well, okay, let me say cancer, not infection per se. But what I'm trying to drive at is that there's a particular virus that has been associated with cervical cancer, which is human papilloma virus. And then this virus has also been found to be very high in those people that have HIV. Yes, because of the low immune system, it tends to thrive within their system. And so because of that, they are predisposed to having cervical cancer. Now, in the context of, you know, preventing the cervical cancer is basically by having the vaccine done, just as you have mentioned. However, for now, it's children within the age range of 9 to 14 years that can actually have the vaccine done. And I think maximally, the maximal age is basically 26 years or so. Yes, I think basically 26 years. And then, so probably with research and then constant, you know, work and all that by medical professionals, we may have something, you know, that would help in the future.
Okay. So should the persons living with HIV, you know, check themselves more frequently, even if they've had their vaccination? As adults, you know, as adults, after you've checked, we are told that you can actually have a shot.
Yes.
You've had your shot 5 years after. Should I, as a person that is living with HIV, go more frequently for my checkups, or I should just see it as a person that doesn't have?
Okay, basically, I'd say yes to that answer because, to that question, sorry, because when you go to screen for cervical cancer, basically by pap smear, which is what we do in this environment. So when we go to when you go to screen for cervical cancer, and then the pap smear results turns out to be normal, we usually advise that you should repeat screening in like 3 years' time. Okay. So it also applies to those people that are living with HIV. However, if you tend to have some symptoms that you are not too comfortable with, probably having symptoms that suggest cervical cancer, like bleeding per vagina, or, you know, having bleeding after intercourse, and probably even pain with intercourse, then you should go to visit your doctor, and then that will be taken care of.
Dr. Fatima Anga, thank you so much.
You're welcome.
You've been so fluent, and I think you're very conversant with this topic. Thank you so much. So what is your last word for the persons looking at, watching this program with regards to cervical cancer?
Okay, with
regards to HIV.
Okay.
Yes, yeah.
Okay, with regards to HIV, I'd say prevention is the mainstay of managing HIV. Okay. Basically, in the aspect of prevention, is for you to take care of yourselves. Try to be faithful. If you're not, abstinence first. If you're not able to abstain, try to be faithful with one partner. If you're not able to be faithful with one partner, then condom use, you know, should be effective. So
condomized sex is encouraged here for those persons who cannot. Really. They say if you know fit hold the body. So thank you so much, Dr. Anga, for coming, and thank you for the insights. We hope to see you again on this program. We're going to our next segment now that has to do with the health personality of the week. Don't go away. We'll be talking about Dr. Olaleko Olatishe. Let's see who he is and what he does.
Our health personality for the week is Dr. Olaleko Olatishe, a prominent Nigerian medical professional nephrologist, CEO of Zenith Medical and Kidney Center, Abuja. He hails from Oyo State, a graduate of MBBS from University of Jos in 1998. He had his master's in transplantation science in the University of Liverpool, United Kingdom, solidifying his expertise in the field. A fellow of the National Postgraduate Medical College of Nigeria Nephrology. He has further pursued training and education in healthcare management administration, enhancing his expertise in running medical facilities effectively. Dr. Olatishe has earned recognition for his expertise in his field and his commitment focusing on improving patient care and advancing medical practices. His contributions to the field of medicines have been profound. He has excelled in general nephrology, renal transplantation, dialysis, and general medicine. His dedication to the field and visionary approach have significantly impacted healthcare delivery in Nigeria. An awardee of excellence in medical leadership due to his unwavering commitment in providing affordable medical care in Nigeria is highly commendable.
Okay, welcome back. And our regular guest, Dr. Ben Amodu, is in the house. Today, we are not going to be specific about any particular disease. We are going on an advocacy drive for phytomedicine. Dr. Amodu believes that with our circumstances in the tropics and where we live, we need to be able to take care of ourselves with the things we have around our environment. So, Dr. Amodu, you're welcome to the program.
Yeah, thank you, and good day, Nigerians.
Okay, so just tell us why we must, or why we should be focusing on phytomedicine, looking at the economy and the possibilities of cashing on it.
As we speak today, Polaris Research Group has indicated that herbal medicines trading is $412 billion as of today. And what started like play with $200 billion is now gone to 400 and something. And as I speak, this trade is dominated by the European countries. And if you look at the growth and many other things surrounding the herbal medicine industry, they grow here in the tropics, in our region, here, Asia, and what have you. But for the European countries to dominate it by 42.5% is worrisome. And when you look at our Nigerian herbal medicine trade so far, it's under $50 billion, which is nothing to talk about.
So what is the global projections for phytomedicine?
Yeah, that's a good one. There's a projection too by the group that $6 trillion is the projection for what we have, the raw materials here.
So what market share do you think we should be targeting to be able to make sense of it?
We should be targeting a lot. Why do I say this? So far, WHO is worried about incidences of non-communicable disease that has got up to 74%. The global deaths in the whole world, number one cause of death in the world is the non-communicable diseases. From the research I'm doing, my colleagues are doing, with the results we have, some terrible illnesses that cannot be well managed in the world. We have our research work showing that our products can manage them. What do I mean? Issues of an enlarged heart, which takes about $100,000 to $150,000 to do an open heart surgery, in which case 10 people may go in, only one survives. Whereas you use the combinations of these products and the heart comes back to normal within a week.
So, Dr. Amodu, each time you come to talk, I keep asking, how do people reach you? Tell us. And if there's any number to put on the screen, please let's have it. For Dr.
Before I do that, while I was waiting for you, you discussed about HIV/AIDS.
Yeah.
Our report is on the internet. There is no lies here. As a lawyer, I say res ipsa loquitur. The thing will speak for itself. For HIV.
Dr. Amodu, are you also a lawyer?
Of course.
A pharmacist and a lawyer?
Of course.
Oh my goodness.
You know, so it's res ipsa loquitur. The thing will speak for itself. We did a test, which results with the university is on the internet, where we tested our herbal vaccine. The doubting Thomases, when the COVID came, they said, no, it's not possible. A vaccine has to be injection. Not all vaccines will be in injectable form. In the herbal sector, we have them in capsules. When I was in Dodan Barracks, we were dispensing 3 capsules of typhoid vaccine in those days.
Okay, now.
To prevent typhoid.
Dr. Amodu, time is not our friend. Tell them at home, what is it you want to say today as a final word on your advocacy speech?
On the advocacy is that Nigeria has a lot to gain if they can bring together the research we are doing. Those ones that the Nigerian Natural Medicine Development Authority is doing We'll bring it together, jam, and the whole world will be in our hands. Abuja, we want a fulcrum of herbal medicine tourism to revolve around FCT. When people travel, Mugabe, before Mugabe died, the wife traveled all the way from far east to do fibroid operation, which he could have stayed in our own Nikon here, and I dispensed my products in a few days. Madam's fibroid would have gone.
Okay, okay.
You know, if you want to reach me for further consultation because of
please, can we have the number there?
the time?
Yeah.
I'm on 808 080 37 899 735.
Okay, thank you, Dr.
No. 080 37 899 735.
Thank you.
It's a pleasure.
That's correct. Thank you.
It's a pleasure.
All right. So, visitors, viewers at home, please thank you for watching. On behalf of my executive producer and my supervising producer, the crew, and for special mention, the Nigerian Medical Association for supporting us with resource persons all the time. I thank you very much, the NMA. For more information, please just watch our promos and join us again on Monday at 8:05 p.m. on DSTV channel 419. Thank you so much. See you next week.